High blood pressure or hypertension. Symptoms, causes, prevention and treatment. High blood pressure, also called hypertension, is a blood pressure that is higher than normal. Your blood pressure changes throughout the day based on your activities. Having blood pressure measures consistently above normal may result in a diagnosis of high blood pressure or hypertension. The higher your blood pressure level, the more risk you have for other health problems such as heart disease, heart attack and stroke. You may be more likely to have high blood pressure due to your genetics, age, and whether you have certain health conditions. Your blood pressure measurement takes into account how much blood is passing through your vessels and the amount of resistance the blood meets while the heart is pumping. High blood pressure or hypertension occurs when the force of blood pushing through your vessels is consistently too high. Narrow blood vessels, known as arteries, create more resistance for blood flow. The narrower your arteries are, the more resistance there is, and the higher your blood pressure will be. Over long term, the increased pressure can cause health issues, including heart disease. Hypertension is quite common. In fact, since the guidelines in 2017, nearly half of American adults could now be diagnosed with this condition. Hypertension typically develops over the course of several years. Usually, you don't notice any symptoms, but even without symptoms, high blood pressure can cause damage to your blood vessels and organs, especially the brain, heart, eye, and kidneys. Early detection is important. Regular blood pressure reading can help you and your doctor notice any changes. If your blood pressure is elevated, your doctor may have you check your blood pressure over a few weeks to see if the number stays elevated or falls back to normal levels. What are the symptoms of hypertension? High blood pressure usually has no warning signs or symptoms, and many people do not know they have it. Measuring your blood pressure is the only way to know whether you have high blood pressure, so hypertension is generally a silent condition. Many people won't experience any symptoms. It may take years or even decades for the condition to reach levels severe enough that symptoms become obvious. Even then, the symptoms may be attributed to other issues. Symptoms of severe hypertension can include flushing, blood spots in the eyes, subconjunctival hemorrhage, dizziness. According to the American Heart Association, contrary to popular thoughts, severe hypertension does not typically cause nosebleeds or headaches, except when someone is in hypertensive crisis. The best way to know if you have hypertension is to get regular blood pressure readings. Most doctors' offices take a blood pressure reading to every appointment. If you only have yearly physical talk with a doctor about your risk for hypertension and other readings, you may need help to watch your blood pressure. For example, if you have a family history of heart disease or you have risk factors for developing this condition, your doctor may recommend that you have your blood pressure checked twice a year. This helps you and your doctor stay on top of any possible issue before they become problematic. What causes high blood pressure? There are two types of hypertension. Each type has a different cause. Essential or primary hypertension. Essential hypertension is also called primary hypertension. This kind of hypertension develops over time. Most people have this type of high blood pressure. A combination of factors typically play a role in developing of essential hypertension. These factors include genes. Some people are genetically predisposed to hypertension. This may be from gene mutation or genetic abnormalities inherited from parents. Age. Individuals over 65 years old are more at risk for hypertension. Race. Non-white, non-Hispanic individuals have a higher incidence of hypertension. Living with obesity. Living with obesity can lead to cardiac issues, including hypertension. High alcohol consumption. Women who habitually have more than one drink per day, or men who have more than 2 drinks per day, may be at an increased risk for hypertension. Living a very sedentary lifestyle. Lowered levels of fitness have been connected to hypertension. Living with diabetes and/or metabolic syndrome. Individuals diagnosed with either diabetes or metabolic syndrome are at a higher risk of developing hypertension. High sodium intake. This is more association between daily high sodium intake, more than 1.5 grams a day, and hypertension. Secondary hypertension. Secondary hypertension often occurs quickly and can become more severe than primary hypertension. Several conditions that may cause secondary hypertension include kidney disease, obstructive sleep apnea, congenital heart defects, problems with your thyroid, side effects of medications, use of illegal drugs, chronic consumption of alcohol, adrenal gland problems, certain endocrine tumors. If your blood pressure remains high, your doctor will likely conduct more tests to rule out underlying conditions. These tests can include cholesterol screening and other blood tests, test of your heart's electrical activities with an electrocardiogram electrocardiograph, sometimes referred to as ECG, ultrasound of your heart or kidneys, home blood pressure monitor to monitor your blood pressure over a 24-hour period at home. This test can help your doctor identify any secondary issues causing elevated blood pressure. They can also look at the side effects high blood pressure may have had on your organs. During this time, your doctor may begin treating your hypertension. Early treatment may reduce the risk of lasting damage. What are the effects of high blood pressure on the body? Because hypertension is often a silent condition, it can cause damage to your body for years before symptoms become obvious. If hypertension is not treated, you may face serious, even fatal complications. Complications of hypertension includes the following: damaged arteries. Healthy arteries are flexible and strong. Blood flows freely and unobstructed through healthy arteries and vessels. Hypertension makes arteries tougher, tighter, and less elastic. This damage makes it easier for dietary fat to deposit in your arteries and restrict blood flow. This damage can lead to increased blood pressure, blockages, and eventually heart attack and stroke. Damaged hearts. Hypertension makes your heart work too hard. The increased pressure in your blood vessels force your heart muscles to pump more frequently and with more force than a healthy heart should have to. This may cause an enlarged heart. An enlarged heart increases the risk of the following: heart failure, arrhythmias, sudden cardiac death, heart attack. Damaged brain. Your brain relies on a healthy supply of oxygen-rich blood to work properly. Untreated high blood pressure can reduce your brain's supply of blood. Temporary blockages of blood flow to the brain are called transient ischemic attacks, TIAs. Significant blockages of blood flow cause brain cells to die. This is known as a stroke. Uncontrolled hypertension may also affect your memory and ability to learn, recall, speak, and reason. Treating hypertension often does not erase or reverse the effects of uncontrolled hypertension, but it does lower the risk for future problems. Treatment for hypertension include both prescription medication and healthy lifestyle changes. A number of factors help your doctor determine the best treatment option for you. These factors include which type of hypertension you have and what causes have been identified. Primary hypertension treatment options. If your doctor diagnoses you with primary hypertension, lifestyle changes may help reduce your high blood pressure. If lifestyle changes alone are not enough, or if they stop being effective, your doctor may prescribe medication. Secondary hypertension treatment options. If your doctor discovers an underlying issue causing your hypertension, treatment will focus on the other condition. For example, if a medication you have started taking is causing an increased blood pressure, your doctor will try other medications that don't have these side effects. Sometimes, hypertension is persistent despite treatment for underlying cause. In this case, your doctor may work with you to develop lifestyle changes and prescribe medications to help you reduce your blood pressure. Treatment plans for hypertension often evolve. What worked at first may become less useful over time. Your doctor will continue to work with you to refine your treatment. Medications. Many people go through a trial and error phase with blood pressure medications. Your doctor may need to try different medications until they find one or a combination that works for you. Some of the medications used to treat hypertension include beta blockers. Beta blockers make your heart beat slower and with less force. This reduces the amount of blood pumped through your arteries with each beat, which lowers blood pressure. It also blocks certain hormones in your body that can raise your blood pressure. Diuretics. High sodium level and excess fluid in your body can increase blood pressure. Diuretics, also called water pills, help your kidneys remove excess sodium from your body. As the sodium leaves, extra fluid in your bloodstream moves into your urine, which helps lower your blood pressure. ACE inhibitors, angiotensin II receptor blockers, ARB. While ACE inhibitors aim to stop the creation of angiotensin, ARBs block angiotensin from binding with receptors. Without the chemical, blood vessels won't tighten. This helps relax vessels and lower blood pressure. Calcium channel blockers. These medications block some of the calcium from entering the cardiac muscles of your heart. This leads to less forceful heartbeats and a lower blood pressure. These medications also work in blood pressure vessels, causing them to relax and further lowering blood pressure. Alpha-2 agnostics. This type of medication changes the nerve impulses that cause blood vessels to tighten. This helps blood vessels to relax, which reduces blood pressure. Home remedies for high blood pressure. Healthy lifestyle changes can help you control the factors that cause hypertension. Here are some of the most common ones. Developing a heart-healthy diet diet. A heart-healthy diet is vital for helping to reduce high blood pressure. It's also important for managing hypertension that's under control and reducing the risk of complications. These complications include heart disease, stroke, and heart attack. A heart-healthy diet should include fruits, vegetables, whole grains, lean protein like fish, increasing physical activity. In addition to helping you lose weight, if a doctor has recommended it, exercise can help lower your blood pressure naturally and strengthen your cardiovascular system. Aim to get 150 minutes of moderate physical activity each week. That's about 30 minutes 5 times per week. Reaching an optimal weight. If you are living with obesity, maintaining a moderate weight with a heart-healthy diet and increased physical activity can help lower your blood pressure. Managing stress. Exercise is a great way to manage stress. Other activities can also be helpful. These include meditation, deep breathing, massage, muscle relaxation, yoga, or tai chi. Getting adequate sleep may also help reduce stress levels. Quitting smoking and limiting alcohol. If you are a smoker and have been diagnosed with high blood pressure, your doctor will most likely advise you to quit. The chemicals in tobacco smoke can damage the body's tissue and harden blood vessel walls. If you regularly consume too much alcohol or have an alcohol dependency, seek help to reduce the amount you drink or stop altogether. Drinking alcohol in excess can raise blood pressure. Lifestyle tips to lower your risk of hypertension. If you have risk factor for hypertension, you can take steps now to lower your risk for the condition and its complications. Add fruits and vegetables to your diet. Slowly work your way up to eating more servings of heart-healthy plants. Aim to eat more than 7 servings of fruits and vegetables each day. Then aim to add more serving per day for 2 weeks. After those weeks, aim to add 1 more serving. The goal is to have 10 servings of fruits and vegetables per day. Limit refined sugar. Try to limit the amount of sugar-sweetened foods like flavored yogurt, cereals, and sodas you eat on a daily basis. Packaged foods hide unnecessary sugar, so be sure to read labels. Reduce sodium intake. People living with hypertension and those with an increased risk for heart disease may be advised by their doctor to keep their daily sodium intake between 1,500 mg to 2,300 mg per day. The best way to reduce sodium is to cook fresh foods more often and limit the amount of fast foods or prepackaged foods you eat, which can sometimes be very high in sodium. Set weight loss goals. If your doctor has recommended you lose weight, talk with them about an optimal weight loss goal for you. The Centers for Disease Control and Prevention (CDC) recommend a weight loss goal of 1 to 2 pounds a week. This can be achieved through a more nutritious diet and increased physical exercise. Employing the help of a trainer or fitness app and possibly even a dietitian are all methods to help you learn how to make the best choices for your body and your lifestyle. Monitor your blood pressure regularly. The best way to prevent complications and avoid problems is to recognize hypertension early. Keep a log of your blood pressure readings and take it to your regular doctor appointments. This can help your doctor see any possible problems before the condition advances. Conclusion: high blood pressure, also known as hypertension, is a common health issue in the United States. If you have recently been diagnosed with high blood pressure, your treatment plan will vary depending on factors. This includes the severity of your high blood pressure and what medication your doctor thinks will be best for you. The good news is that in many cases of hypertension, lifestyle changes can be powerful tools for managing or even reversing your diagnosis. These changes include incorporating more nutritious fruits and vegetables into your diet, getting more physical activity, limiting your sodium intake, and limiting your alcohol consumption. Because hypertension often presents no symptoms, it's important to get your blood pressure checked during your yearly physical appointment with your doctor. Severe hypertension can cause serious health issues, so the sooner you have it diagnosed, the sooner it can be managed and possibly even reversed. Hi, thanks for watching to the end. I hope this video has been informative and helpful. If you like this video and you would like to see more contents like this, kindly like, share, leave a comment in the comment section, and also please subscribe to this channel if you have not already subscribed yet. Thanks for watching to the end. Have a nice day and look out for the next video.